My name is Eldred Weiser. I describe myself as a general surgeon and a bit of a country doctor. My training is in general surgery, and that is what I do mostly. My father, J. Eldred Weiser, was a chemistry professor at Middle Tennessee State University. He greatly admired the medical profession and encouraged me to pursue my education in this direction. I'm grateful that he did. I had no exposure to medicine prior to entering medical school, other than taking care of some animals on the farm where I grew up. But once there, I became drawn to caring for patients and their problems. I see patients in my office, in the emergency room, and in the hospital for a variety of problems. Currently, mostly do endoscopies and abdominal surgery. A lot of my patients these days are old friends. One patient that I remember well developed an unusual problem of breast cancer. Throughout her illness, she kept a strong, positive outlet that made me and everyone else taking care of her glad to be around her. Another of my patients was an older gentleman that had recurrent GI bleeding for several days. When it became apparent that the only way that it could be controlled was with major surgery, removing much of his colon, his reply surprised me. He promptly said, "What are we waiting for?" He went through the surgery and the recovery well. Dixon is my home, where my wife and I worked and raised our family. My wife, Dr. Rebecca Griffiths, now deceased, was an emergency room physician and also worked at what was then called Goodlark. Both of us were inspired by the practice and the entrepreneurship of Dr. Jimmy Jackson, one of the three brothers that founded the hospital in Dixon. He spoke of building the hospital into a center of excellence. Small enough to care, large enough to heal is the motto of the hospital. The hospital, from its inception by the Jackson brothers in 1958, was established with a plan to offer the best care possible with the resources available in Dixon. With Dr. Jimmy coming to the end of his career, the hospital was sold to HCA in 1995. The name of the hospital was changed to Horizon in 1996. Most recently, the Joint Commission rated the hospital as a top performer based on key quality measures. At TriStar Horizon, above all else, we are committed to the care and improvement of human life. Small enough to care, large enough to heal is to me a fitting motto for the hospital. Simply put, I've tried to serve where I could. I've been blessed with good parents, a great wife, wonderful children, and a hospital that has allowed me to serve patients for a very long time.